Hello, hello. Good evening, ladies and gentlemen. Good evening, Alternative Healthcare Career Group. Tonight, you are here at the Home Health Contract Show, and we are live. It's October 26, 2020. And welcome to Home Health Contract Show. This is your host, Bert De Vera, physical therapist. And I'm happy to join you tonight in this show. And hopefully, we're going to have a great discussion because tonight, we have a great topic, guys. Tonight, I'm going to discuss with you the difference between a mobile Medicare Part B practice versus a home health contracting practice. So these are both mobile, okay? One is Medicare Part B, and the other is home health contracting through Part A, although we are not exactly billing Part A. I will explain that later further. Okay. But if you're joining us tonight here at Alternative Healthcare Career Group, please comment, say live, say hello. I'd like to greet you tonight. If you're joining us live, if you have any questions, feel free to comment on the comment section. If you are joining us live on our YouTube channel, our Alternative Healthcare Career YouTube channel, please do your comments, or if you have any questions regarding mobile Medicare Part B and home health contracting. So why in the world are we discussing this? Okay. Why are we discussing home health Part B and mobile specifically? Because Medicare Part B has two different settings. Okay. One common setting is the traditional brick and mortar clinic. Okay, for those of you who don't understand brick and mortar clinic, it's literally a brick and mortar, meaning you have a clinic that you lease or you own a building, and you're an outpatient, practice billing Medicare Part B, and it could be a hybrid billing. And if it's a hybrid billing, then it can be a mix of cash base, it can be a mix of Part B, it can be a mix of private insurance. I just want to say hi to our guest tonight. We have Marla from Baton Rouge, Louisiana. Yes, you did speak to me a few weeks ago. Marla, looking forward to talk to you again. Thank you for joining us tonight. I think I discussed with you this topic, but feel free to ask your questions tonight regarding mobile Medicare Part B and home health contracting. So tonight we're going to compare apples to apples, guys. Apples to apples, four main categories. Number one is the barrier for entry. Okay. In any business, you have to ask yourself, okay, how am I going to enter into this business? What are the barriers for entry? Okay. Somebody said, hi, Bert. Hi. It says Facebook user, so I don't know your name. So if you please type in your name, I'll be happy to mention your name. Thanks for joining us tonight. Again, four categories that we're going to discuss tonight. Barrier for entry. Second category is speed of execution. How fast can you execute? Okay. Third category is, I believe that is billing. Yes, billing. How can you bill? How can you get your money? And then the fourth category is, let me see. What's the fourth category? Help me out, Mike. So barrier for entry, speed of execution, billing, and then referral source. There it is. Yes, referral source. So where are you going to get the business? Where are you going to get the referral? Okay. We're going to talk about that tonight comparing mobile Medicare Part B and home health contracting. Okay. So again, going back to the definition of Part B, what is Medicare Part B? Guys, Medicare Part B, like I said, has two two different types of setting. One is the outpatient, and then the second one, which we're going to discuss tonight, is a mobile. So you might ask me, hey, Bert, how are you going to do mobile Medicare Part B? Actually, you only have to check on your application when you apply for credentialing on mobile Medicare Part B. You only have to check that box that says your practice is going to be mobile. Okay. However, just an FYI on the side, even if your application says mobile, even if it's mobile, you will still get a visit with Medicare. Okay, because I got a visit, guys. I got a visit from Medicare. They knocked on my door, and with all the paperwork, and they want to make sure that you are who you say you are. So just a upfront disclaimer or upfront, I guess I will divulge upfront. I have both businesses. I have a Medicare Part B business, and I also have a home health contract business, which is my main bread and butter. Okay, and later on, I'm going to explain why do I have both. Okay, I'm going to explain to you why do I have both. Okay, so mobile Part B versus home health contracting. If you guys have any questions, please feel free to put it now under comment section. Okay? All right. Let me see if we got any questions here. So everybody understands what is Medicare Part B? Yes? All right. Say yes if you understand mobile Medicare Part B, and if not, feel free to ask your questions. Okay. I think we can go ahead and move forward with our comparison. Um, how in the world is mobile Medicare Part B different from home health contracting? Okay. Well, I guess we have to discuss first the similarities. Okay. What are the similarities and who is this for? Okay. So if you're a PT, OT, or SLP and you're looking for a business where you don't want to pay rent, you don't want to pay, lease, and you don't want to sign this contract for a 3-year or 5-year lease, and you just want to have a business that's mobile, then these two options, these two choices are for you. Okay. Mobile Medicare Part B, somebody said here, no, they don't understand what's mobile Medicare Part B. Guys, with Part B, you are billing Medicare directly. Okay. You are billing Medicare directly. But before you can bill Medicare directly, you have to be credentialed. When you say you have to be credentialed, meaning you have to have a Medicare number as a clinician, and then you have to have a Medicare number as a business. Okay. Another question here is, can we do mobile practice with private insurance? The answer is yes, if you apply to be a provider for that private insurance. Let's say Blue Cross Blue Shield, Aetna, Cigna, what else? United Healthcare, Humana. Okay. All of those companies have to be applied for. In other words, you have to be a network with them in order for you to bill those agencies, obviously. I mean, those companies, those insurance companies. Okay. All right. So going back, in order for you to be a Medicare Part B provider, obviously you have to have a Medicare number. Okay. How do you do that? You have to apply to get credentialed. Now, there are companies that would do the credentialing for you, or you can do the credentialing yourself. All right. Let me take a sip real quick. Keep the questions coming, guys. I love it. Okay. So now you might ask, how do I do a business under mobile Medicare Part B to where I have other therapists working for me? That's a very important question. If you want to have a mobile Medicare Part B practice and you want therapists to work under you, you have to have a group number. So a group number is like an umbrella. Okay. So like this wallet, this is your umbrella. This is like your group where Medicare assigns a number for this group. Okay. Now, under this group number, which belongs to you, because on your application, you will have your company name in the application. You will have your information, everything that Medicare would ask before they can issue a group number for you. Now, under this group number, you now have your individual. This pen acts like the individual clinicians. Okay. You have your individual clinicians. So each clinician has his own Medicare number. Okay? Their Medicare number has to be tied into this group number. Okay? Let me explain. Let's say you want to name your business ABC Physical Therapy or ABC Rehab. Under Medicare rules, ABC Rehab has to have a Medicare group number. Okay? And let's say you want to hire me and Mike and Emma to work for ABC Rehab. Under Medicare Part B rules, myself, Mike, and Emma has to have an individual clinician number, and it will be tied up with ABC Rehab. What do I mean by that? Any patients we treat, let's say I treat a patient, Mike treats a patient, and Emma treats a patient, and you want to bill for those patients we treated, in order for you to be able to bill for what we did, our Medicare number has to be tied to your business Medicare number. Otherwise, Medicare will not know who to send the money, to. Okay. So in that case, once ABC Rehab, ABC Rehab has its own group number, and under that you have me, Mike, and Emma. Everything we do under ABC Rehab, Medicare now will send money to ABC Rehab for every treatment we did, for every unit we build, because we are under ABC Rehab, which is your business. Does that make sense? Okay. Hi, Michelle from Texas. OT in Texas in the house. Yeah, howdy. Thanks for joining us, Michelle. So that, my friends, is Medicare Part B. El Capitan, thanks for joining us. David Bailiff from Phoenix, Arizona. Thank you, sir, for joining us tonight. Appreciate you. So, is it Phoenix or Scottsdale? I know you're in Arizona. Thanks, bud. So, that's Medicare Part B. All right. The money is coming obviously from Medicare. So in order for you to get money from Medicare, you have to be registered with Medicare. You have to have a Medicare number. All right. And if you want to know more about how to get your Medicare number, I have a very good friend who is actually an expert in doing that. Okay. But like I said, tonight, the goal of our discussion tonight is to compare both. Okay. So if you're scratching your head, hey, Bert, what do I do? Medicare, mobile Medicare Part B, or home health contracting? Which one would I do? Okay. That's up to you. It's totally up to you. After we discuss the 4 categories to compare the 2 tonight, you can come up with your own decision. Okay. I can't decide for you. Okay. All right. So are we ready to show the comparison of these 2? Mobile Medicare Part B versus home health contracting. Someone from Franklin, Tennessee is joining us tonight. I don't see your name. Pardon me, but whoever you are, it just shows Facebook user from my end. But welcome. Thanks for joining us tonight. Okay, so let's go ahead and discuss mobile Medicare Part B versus home health contracting. I'm going to discuss with you guys my screen. Share with you my screen. All right. Are we ready, Mike? Let me open my Keynote. Oop, that is not what I want. Where is the other Keynote? There you go. Hi, Christine from Franklin, Tennessee. Thanks for joining us. All right. Bear with me, guys. I'm about to share with you my screen. Okay, here we go. I'm going to pull it up and put it on a play mode. All right. Can you guys see my screen? Yes? Let me escape real quick. Did you guys see my screen earlier? Can somebody say yes? And then I'm going to pull it up again. Yep. All right. Okay. All right. Here we go. All right, guys. Game on. Here we go. So, mobile Medicare Part B versus home health contracting. If you are joining us tonight, guys, this is the time to grab your pen, grab your notepad, and put a column side by side so you can kind of see which one is better for you based on what you want to do, based on what you're willing to put up with, based on the type of work you're willing to put in. All right. So here we go. So tonight we're going to compare the barrier for entry, the speed of execution, the billing side of it, and then the referral source. Who gives you the patients? All right. So number one, barrier for entry. With mobile Medicare Part B, you have to wait 60 to 90 days for credentialing. Okay. So what happens is you fill out this long Medicare form, put in your name, everything, and then along with your credentials, you have to submit it to Medicare, and it takes 60 to 90 days for them to get back to you. Sometimes it's shorter, but 60 to 90 days is the norm. Okay. Another thing is during this 60 to 90 days, if you're missing something, it's going to be a back and forth thing with Medicare. Okay. They won't approve your application if you're missing something. So you need this taken care of before you can even start billing Medicare Part B, or before you can even start accepting patients with Medicare Part B. Okay. Now, this applies to your company. Okay. Like I said in my example earlier, for example, ABC Rehab, ABC Physical Therapy, or however you want to name it. This duration of 60 to 90 days applies to that. Okay. Now, for every single clinician, including yourself, again, you have to wait 60 to 90 days of credentialing. For everyone you want to add, PT, PTA, OT, OTA, SLP, again, you have to go through credentialing. Because, as I've said earlier, you cannot bill for something unless that clinician has a Medicare number tied to it. You cannot bill for those units unless the treating clinician has a Medicare number tied to it. And then that Medicare number is tied to your company. All right? So it's as simple as that. How can I explain it in layman's term, or in a different example? Okay. For example, you're working in a hospital. Okay. The hospital cannot bill for whatever you do unless you're working for the hospital. Okay. If you're an outsider and you're not registered as an employee of that hospital cannot bill for what you're doing. You cannot work there in the first place. Okay. Same thing. So I hope you got that part. Now, what about home health contracting? How long does it take for you to start it? As far as getting, do you need credentialing? The answer is no. With home health contract, guys, there's no need for credentialing. What do I mean by that? Because you're not billing Medicare Part B while contracting with the home health, you don't need credentialing. You are not billing Part A directly. The home health agency is doing that. So there's no need for credentialing. Clear so far? Okay. If you have any questions, hold on to it, write it down. After I show you these 4 categories, we're going to tackle them one by one. Okay. All right. So again, barrier for entry, to recap, Part B, 60 to 90 days, home health contract, no need for credentialing. Next, speed of execution. Okay. This brings us to how fast can you execute based on those barriers. Okay. With mobile Part B, like I said earlier, you have to wait until everyone is credentialed before you can bill for what they did, before you can even touch a Medicare Part B patient. Okay. If you're starting on your own, solopreneur for the meantime, again, you have to wait for your own credentialing before you can start billing. Okay. With home health, as long as you have a PRN, you have a license as a therapist, or your PRN staff have a license, guess what? They're good to go. You don't need to wait for anything from Medicare. Okay. Let's say I hired Mike. Hey, Mike, you're a licensed PT in Tennessee. I'm contracting with a home health agency there. Guess what? You can work for me. All right, let me go back. You can work for me as long as you have a license. Okay. Now, in some states, you might need a year or 2 years of experience before you can do home health, but most states don't have that rule. Okay. So there you have it. Speed of execution. Excuse me. It's quicker to execute with a home health contract as opposed to mobile Part B. Okay. Next, billing. How do you bill? With mobile Part B, you have to have a billing software because you have to have codes. And when your billing gets rejected, okay, you can be subject to audit or back and forth. Okay, let's say you put the wrong code or Medicare thinks there's something wrong with your billing, then you have to appeal. So it's a lot of back and forth. Okay. Now, I'm not saying that all of your billings will be a matter of back and forth. If you know what you're doing, like my friend Tony, who's an expert in billing, all right, then you probably won't have this back and forth. If you're willing to put up with codes and appeals and all that, and you think it's worth doing this, then by all means do it. Like I said, I myself, I have my own mobile Part B business. Okay. But I'll be honest with you, I do more home health contracting business as opposed to Part B. And I will explain to you in a little bit why did I do mobile Part B? Why did I apply for my own Medicare number? Okay. So billing, Part B, you're dealing with codes and audits. And then with home health, there's no billing codes. No billing codes. Straight up invoice per visit, guys. What do I mean by that? If you have a contract with a home health agency that says, okay, we're going to charge you a flat rate of $75 or $80 per visit, then that's it. You just invoice it. Okay. You use the software, whatever invoicing software you want to use, and put in there, for example, PT eval, $80. PT visit, $80. OT visit, $75. OTA visit, $75. Whatever it says in your contract that they signed. That's it. It's straight invoice. No codes. Okay? No codes whatsoever, and we are not charging per unit. It's a flat rate based on the contract. Does that make sense? That's a beauty, right? And if the agency gets audited, that's the only time they're going to call you if one of your charts is selected for audit. Okay? You don't deal with Medicare Part A auditing or appeals because you are not billing Medicare Part A with the home health contract business model. The agency does that. Okay? All right. Last category is referral source. How are you going to get patients with mobile Medicare Part B versus home health contracting? With mobile Part B, most of the time, majority of your referrals will come from doctors. Therefore, you better be ready to market to doctors. Okay? Now, in states where you have direct access, you probably don't need a doctor's prescription. Like in Texas, it's 15 days. You don't need doctor's prescription for 15 days. But beyond that, then you're going to need a doctor to sign on your plan of care. The same with other states that are on direct access, maybe 30 days or 45 days. Okay. I don't know exactly per state, but if you're in a direct state or direct access state, at some point, you will need a doctor's order or a doctor's signature on your plan of care beyond the direct access time frame. Okay. So that's where your referral source is coming from. With home health, When you're contracting with home health, the agency are the ones marketing to doctors. I own a home health contract agency. I don't market to doctors. The home health agency does. The way it works, the home health agency goes to doctors' offices or hospitals to the discharge planners or social workers, and they tell them, hey, I own a Medicare certified Part A home health agency. If you have any patients needing home health, send them to us. So most agencies have their own marketers, or what they call patient liaison, okay, or physician liaison, okay. So what happens is they go out and look for possible referral sources for the home health agency, okay. They are the ones marketing. I don't, okay. I only market to the home health agency and present to the agency, look, if you need rehab help, my company provides PT, PTA, OT, OTA, and SLP services. These are our rates. These are the areas we cover. These are the softwares that we know. And if you want to give us a try, give us a shot, we can help you with your rehab needs for home health. That's it. And this is our contract. You ready to sign? Let's sign a contract, right? So, and then that's when you start seeing patients for the agency once they sign the contract. The beauty of presenting your company to a home health agency is this: they don't pay you unless you see a patient for them. So it's a pay as you go basis, okay? If I'm the home health agency, why wouldn't I sign a contract with a contracting agency, a contracting company like my company, if I'm not losing money up front? In other words, I'm only going to pay you if I send you patients, right? So there's nothing to lose. The big difference between a travel agency staffing company and a home health contract company like mine, the big difference is a travel agency staffing company usually requires a minimum of 13-week contract. If you're a traveler, you know this. I used to be a traveling PT. So minimum 13 weeks, the staffing company will send you somewhere across the nation, but the facility has to sign that agreement that they have to pay minimum 13 weeks or however many weeks. That's how they make money. With home health contracting, since we're local, guess what? We don't require the home health agency to sign a 13-week contract, okay? What we do is we tell them, look, you're not going to spend a retainer fee or some money up front, or you're not required to pay us 13 weeks. You only pay us when we see patients for you. All right? Got that? That's how we leverage our contract agency versus a travel staffing company. Plus, since you're local, you know more therapists in the area compared to a travel staffing company. All right? Okay, so there you have it. Again, referral source, billing, what's the first one? Barrier for entry, and then speed of execution. Okay, any questions, guys? I'm going to close this screen and stop sharing, and I'm going to go through all your questions. Okay. Ajit Patel from Chicago, welcome and thanks for joining us. Marla has a question. This includes PTA and CODA. Marla, if you can clarify your question. Includes PTA and CODA for what? Okay, Michelle has a question. What is the billable paid mobile Part B versus 75 to 80 per visit? Okay, so Michelle, let me clarify that. With Medicare Part B, you bill Medicare per unit. So I think it's 15 minutes per unit. All right. So whatever units you submit in your billing is the money you're going to get. And with Medicare Part B, you're actually not going to get 100%. You're only going to get about 80%. And if the patient has what do you call this, a supplemental insurance, let's say Medicare, Medicaid, or Blue Cross Blue Shield, it picks up the remaining 20%. Okay. So with mobile Medicare Part B, the money coming in is dependent on the codes you use based on your treatment. Let's say you treated the patient for 15 minutes or 1 hour. Okay. So that's 4 units. Okay. Whatever you use for this code, for example, eval, gait training, TheraX, ultrasound, those correspond to a certain amount of money. Okay. And that's what's going to come back to you. With a home health contract business, like what I have, you basically have a contract it says in the contract, regardless whether PT, PTA, OT, OTA, or SLP visits the patient, this is our rate. Okay. So in one example that I use, like in Texas, the minimum rate is about $75. It can go as high as 80 to 90, okay, depending on your contract. So the way we make money, if I send my PTA after my PT eval or after the PRN PT that works for me does the eval, I pay my PTA 45, and therefore $75 that we charge minus 45, I make $30 profit. Okay. If we charge 80 based on the contract, I pay my PTA 45, then I make $35. Okay. Is that clear? Hopefully that's clear. All right. All right. So the PTA and CODA need Medicare numbers to be in the Medicare Part B, or only PT and SLP? Okay, guys, this is a great question from Marla. The PTAs and the CODAs, do they need Medicare numbers to be in the Medicare Part B, or you only need Medicare number for PT, OT, and SLP? The answer is everyone needs Medicare number. Everyone needs a Medicare number. Okay. So you cannot bill for what the PTA and the CODA did unless they have a Medicare number. Okay. Everyone has to have that. If I'm mistaken, if anyone here is doing this, let me know. I will stand corrected. But as far as I know, you cannot touch any Medicare Part B patient unless you have a Medicare Part B number. All right. Okay. Belisa, thanks for joining us. Long time no see. Your question is, are your employees 1099? Very good question. Guys, if you know what's the difference between a contractor and an employee, that number corresponds to that. If you have contractors, independent contractors, it's called 1099. What it means by that is at the end of the year, they get a copy they can use to file their taxes called 1099. Okay. With 1099, no taxes are taken out, which means if you pay someone $45, they get the full $45. Okay. Whereas with W-2, taxes are taken out. So if you pay someone 45 minus tax, they're probably going to take home $40. Okay. Depending on their tax deductions. Okay. So it really depends how you want to run your company. Are your employees 1099? It depends what state you are. In California, they now have what they call AB5. It's a new state law that discourages 1099 or independent contractors in different industries. Okay. The loophole to that, as far as what I've heard, is this. If your PRN staff have their own business entity, either LLC or S Corp, then you can contract with them business to business. I think that's the loophole. Okay. Now, if you're in a state where it's not 1099 friendly, like California, better be on the safe side and put everyone under W-2, or W-4 is the form they fill out. That's the IRS form. And then at the end of the year, they get a W-2. That's the safest side. Okay. But if you're in a state that allows 1099, and like in my case, Texas, okay, 1099 is okay in Texas, And depending on your CPA, you have to talk to your CPA and discuss the situation. Are my staff 1099 or are they W-2? So you have to answer specific questions. These are test questions whether someone will be treated as an independent contractor or an employee. Okay. So, for example, how do you know if someone is an independent contractor? Like, for example, let's use real estate as an example. If a plumber comes to your house, fixes your plumbing, are they your employee? No. Okay. They're a contractor. You pay them for what they do, and then that's it, right? Same with electrician. Same with a carpenter. Okay. Now, with the rehab business, if you hire a PT, PTA, OT, OTA, and you're not telling them what to do, and they schedule their own visit times, they own their own equipment, and guess what? They should be a contractor. Okay. If you're not obliging them to report at a certain time, you're not telling them what to do and how to treat a certain patient, okay, and they do their own schedule, they have their own equipments, they should be contractors. Okay. All right. So more questions are coming in. Before we answer the next question, we're going to go into a short break, guys. Don't go anywhere because we have great questions. And if you want to know more about home health contracting, we do give a free video, actually 4 videos that explains to you how this business works. You just have to go to, at the bottom of this screen, you will see the 4 video series. You go to riyadpreneur.com/Mike Chua. That's where you can grab the 4 videos for free. So don't go anywhere. We have another question from Marla. We will get to that after our short break.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
A new rehab device is changing lives in physical therapy and possibly impacting those with debilitating diseases.
They said I was never going to run, and I'm running. The first day they put a new gait on me, I immediately felt my leg again.
An invention geared towards athletes has inspired a new tool for physical therapy throughout the UP.
TV6's Nicole Buckman has more on the life-changing new gait device.
Improving therapy outcomes and restoring hope to patients. The NewGate is a patented wearable harness system comprised of shoulder straps, a waist belt, and limb straps, all interconnected by strategically placed elastic bands.
There was a point where I just wanted to stop and give up. The NewGate kind of gave me that hope again.
A patient introduced me to the NewGate. Clicked right away that it would make sense. I've been using it with patients on a regular basis ever since.
We're a team who cares in a way that is maybe unique for this day that we live in. And there's something within me that is really fulfilled by working on this project and watching what it can do.
All right, we are back. Thanks for joining us, guys. And if you're just now joining us, this is the Home Health Contract Show here inside the Alternative Healthcare Career Group. And this is your host, Bert De Vera, physical therapist. If you want to know how long I've been a physical therapist, it's been too long. I've been a physical therapist since 1998. So this is my 22nd year as a physical therapist. I started my own business in 2003. So I've owned my own home health contracting business for the past 17 years. So for the first 6 years of my career, 98 to 03, I was an employee, worked 40 hours a week, 60 hours a week, been there, done that, got the t-shirt for it. Okay. So if you're struggling right now and you are thinking of, golly, I want to get out of the 9 to 5 job, I want to get out of working for someone, and I just want to start my own business, then this is the right show for you, because this home health contract business is one of the business models where you have low overhead, you pay as you go, you don't hire any full-time employees, you only pay your PRN staff when they see patients for you, which means you have money coming in. All right. Okay. So far, we have compared mobile Medicare Part B versus home health contracting. Again, to recap, similarity, both are mobile based, obviously, but mobile Medicare Part B has a lot more requirements because you need credentialing. You have to have a software for billing. You have to deal with codes. Whereas with the home health contracting, you don't need credentialing. You only hire PRN staff, no need for credentialing them. And then you don't deal with billing codes. You bill the home health agency straight up. With mobile Part B, you market to doctors. At some point after your direct access time frame, you need doctors to sign off of your plan of care. With home health contracting, you don't market to doctors. The home health agency does that, and therefore they do the marketing for you. That's why I like it. That's why I do it more than mobile Part B. Okay. But we have a question that we need to answer, and this is from Marla, username The Lovely. How do they get a Medicare number? Simple. You have to apply to Medicare. Okay. The owner applies when they're hired, or they apply for Medicare number themselves. Okay. You can apply for Medicare number yourself. Go to medicare.gov and do your research, or you can outsource it, or you can follow instructions from those who have done it, however you want to do it. But bottom line, you have a 60 to 90 days waiting period and back and forth with Medicare if you're missing some credentials or if you're missing something. Okay. Okay. Next question, also from Marla. If they have a number in existence when they're hired, let's say you already have your company and you hired someone due to working with a company prior, you just add them under your umbrella for your company? No. You cannot use their clinician number from their prior work because that number is tied to that company. You have to have your own application for your hire on your own company. Okay? So this Medicare number is like your ID as a clinician. Okay? Let me pull something. Let's say this is my ID. I used to work for ABC outpatient. This ID, this Medicare number, is tied to ABC outpatient. I cannot use this ID to work for, QRS outpatient, because this ID belongs to or tied to ABC outpatient. In order for me to work with QRS rehab or outpatient, QRS rehab has to get a new ID for me. Because if I use the prior number, they cannot bill for it. QRS cannot bill for that under that number. You understand? Because that number is under ABC. Okay? It's like saying, okay, this ID is for this SNF, for Reliant. For example, I cannot use this Reliant ID to work for what do you call this? Daylight, other company names, or Rehab Optima, or whatever. That ID only sticks to that or works for that company. Does that make sense? But a very good question, though. Very good question. Again, that's my understanding. If as far as I know, I'm right. If I'm wrong and you're doing, outpatient, please correct me. Okay. All right. The answer is yes. Thank you. Makes sense. Okay. So the question on Marla is, what would you rather do? Would you rather go through all those credentialing and all that and waiting, or would you rather contract with a home health company and boom, start right away? As soon as you get your contract signed, you have your PRN staff who are ready to go and their license. Okay. All right. Another question from Michelle is what, I guess she meant EMR or electronic health record do you use, whatever the home health company uses. Yes. So Michelle, that's a very good question. So with home health contracting, Michelle is asking, what software do we use to document for home health agencies? We use whatever they use. Okay. We use whatever they use. Now, if you have PRN staff that are complaining and will tell you, for example, hey, Bert, why are we learning different softwares? Why can't we just use one software? Okay. Why do I have to learn 3 or 4 or 5 software? It's because you are serving the home health agency. Okay. You're serving the home health agency, and therefore we want to make it as painless as possible for the home health agency for us to see patients for them. If we're going to use one software alone and you let the agency learn your software, that's another obstacle for them. You see what I'm saying? Basically, you're asking the agency to learn your software so they can get your notes. To me, that's an obstacle. Okay. And if you have the scheduler or you have the intake coordinator, from that agency, and they find out that they have to learn your software, guess what? That's another work on their plate. Okay. Would they want to learn your software just to give you a patient? They probably will, but they probably won't use you as much as they want to, because now you're giving them another work. Okay. Now, if you're thinking of starting a home health contracting business and one of your thoughts would be, hey, Bert, isn't that a hindrance if I ask my PRN staff to learn every single software? Okay. I'm going to give you a secret. This is how I handle that. Okay. If you have PRN staff who are complaining about, golly, why do I have to learn different software? This is my comeback. Okay. How many subjects did you learn in PT school or OT school or SLP school? Did you just learn one subject? Did you just study anatomy? No, right? You studied physiology, kinesiology, pathophysiology, microbiology, right? Different subjects. So quit complaining. Okay. Quit complaining that you have to learn different softwares. And if you want to work, if you want to be marketable, you have to learn different softwares. Guys, SOAP is SOAP, eval is eval. It's just a matter of knowing where to click. Once you know where to click, which is normal, it's a learning curve, right? Once you know where to click, that's it. You know it, okay? How many social media programs have, come out and everybody learns it? You got TikTok, you got Facebook, you got Instagram, okay? Everybody learns all that stuff, okay? So don't complain about learning a new software for a home health agency so you can see patients, okay? It comes with the territory. And the more software you know, the more marketable you are, like I said. Okay, if I'm hiring you as a PRN, PT, or PTA, OT, or CODA, and I ask you, hey, do you know the Vero software? Yes. Okay. Do you know Kinser or WellSky? Yes. Do you know Home Care Home Base? Yes. Do you know Therapy Boss? Yes. Simple as that. SOAP is SOAP. SOAP. They're all the same. You just got to know where to click. All right. Cool. All right. There's another question here. Is the Medicare number different or the same with the NPI number? Isn't the NPI number attached to the employer regardless of employer? The NPI, I believe, stays the same, but the Medicare number assigned to you as a clinician will be different for a certain group of Medicare certified outpatient group. Or does that change too when they change companies like the Medicare number you were just explaining? Okay. NPI stays the same. As far as I know, NPI is your number that stays the same when you log in to the Medicare website. It's like your username, password. But as far as Medicare number assigned to you, okay, that changes because it's attached to a certain company. In order for that company to bill for what you did, they have to be tied together. Okay? So it's like marriage, husband and wife. Okay? They have to be tied together in order for you to be considered as one entity, or what you belong to the same tribe or group. Okay? I think what we can do next time is we can get a Medicare Part B expert in my show, and we can dive in further. I know one guy who is an expert in doing this. But for now, for tonight, I am just showing you guys the differences. I mean, the difference between mobile Part B and home health when it comes to the 4 categories. Okay. There's a lot more topic. If all you want to discuss is Medicare Part B, there's a ton of topic. There's seminars, conventions about that. And tonight is not that, it's not for that topic. We're just doing the comparison. Barrier for entry, speed of execution, the billing, and referral source. That's our goal for tonight. Okay. But again, my bread and butter is home health contract because you can execute really quickly. Okay. Okay. To answer the question, all right, Bert, if all you want to do is, or if the majority of your business is home health contracting, then why did you have your own Medicare Part B number? Why did you apply for it? Here's why. Because when my patients are no longer homebound and they still need therapy and they have Medicare Part B, guess what? I can see them under mobile Medicare Part B. So there's a continuity of treatment. That's another business on the table. Okay. As long as we have a doctor's order, as long as we're in compliance with the regulations under Medicare Part B, we can see them when they're no longer homebound. Okay. But we have to make sure they're discharged from the home health agency. Okay. And of course, you got to make sure that it's cool with the home health agency and it's cool with the doctor, with the orders that you have. Okay. You don't want to do business with a home health agency and then start recruiting their patients for your Part B business. That's unethical. You don't want to do that. Okay. So it has to be transparent. It has to be out in the open, whatever you're doing. That way, everybody's clear. Okay. Guys, again, if you want to know how a home health contract business works, go to rehabpreneur.com/Mike Chua, and you will see the 4 videos on how a home health contract business works. Okay? Any more questions? Okay, we got some more questions. Question here is, if you hire a contract PRN therapist, do they need to have a Medicare number for the agency you're contracting with? No. Okay? Again, if I'm contracting, and I am contracting, I'm contracting with a home health agency. Okay, write this down. Contracting with home health agency does not require a Medicare number. Does not require a Medicare number. All I need when contracting with a home health agency is the contract that they sign with me. I have those contracts. I give those contracts to the ones I mentor who are into my program. These contracts are done by lawyers. These contracts are between my company. My company's name is Therapy Outsource, between Therapy Outsource and whatever home health agency. For example, ABC Home Health, the contract says this contract is between Therapy Outsource, my company, and ABC Home Health. Just an example. Okay? All right. Another question. If you see a patient under Med B, do you need to ask patient to pay the 20% for copay? That's a very good question. Okay. Patients are obliged to pay you the 20% copay. You can either bill them or you can either write that off. That's what I heard so far. Now, if they have Medicaid, Medicaid picks up the 20%. If they have supplemental insurance, whatever that is, you can bill that supplemental insurance for the 20% copay. All right. If you're doing mobile Part B and you're joining us tonight, please comment on that. If I'm wrong, I'll stand to be corrected. I want to know what's the right answer, but as far as I know, that's how it works. All right, guys. Any more questions? Okay. No more questions. I guess that wraps up our show for tonight here at the Home Health Contract Show. Again, if you want a business that's fast to execute, okay, and there's no barriers like 60 to 90 days credentialing, consider home health contracting. With home health contracting, you have leverage. Oh, before I forget, with home health contracting, you can use PTA and quotas, right away. As soon as a PT does the eval, OT does the eval, you can use PTAs and quotas. With Part B, you can only use PTAs and quotas if you are within the vicinity, if you are, what they call doing direct supervision. However, there's, according to Mike, there's a recent 90-day moratorium or hold on that rule from October 23, count 90 days to January. According to Mike, you can actually use PTAs and quotas, and you don't have to be doing direct supervision, but that might end in 90 days. Okay. But then again, you need everyone to be credentialed. All right, guys. Okay. So this wraps up our show for tonight. If you have any questions, feel free to contact me through Messenger, direct message me, or just download that free video, rehabpreneur.com /Mike Chua, or feel free to text me, guys, 972-649-9909. I will listen to you. I will talk to you. I'm a colleague. I'm a physical therapist. I speak your lingo. Text me. Save that number. If you want to schedule with me, 972-649-9909, and we'll figure out what you want to do. If you want me to mentor you on how to start your own home health contracting business, that's what I do. I've helped a lot of colleagues in starting their own business from scratch, and the fastest time frame for executing a home health contracting business so far is within 30 days. And this was done by Ryan Borges from Louisiana. He's one of my students. He was able to execute in 30 days. In 30 days, he had a company, he had a contract, he had a referral, and he was able to invoice. That's how quick. 30 days versus 60 to 90 days waiting for a credential. I think it's a no-brainer. All right. That's it for tonight. Thank you for joining us here at the Home Health Contract Show. Thank you, guys. You're welcome. Somebody says thank you, thank you, thank you. Welcome, welcome, welcome. This is your host, Bert De Vera, signing off. Good night.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
A new rehab device is changing lives in physical therapy and possibly impacting those with debilitating diseases.
They said I was never going to run, and I'm running. The first day they put a new gait on me, I immediately felt my leg again.
An invention geared towards athletes has inspired a new tool for physical therapy throughout the UP.
TV6's Nicole Buckman has more on the life-changing new gait device.
Improving therapy outcomes and restoring hope to patients. The new gait is a patented wearable harness system comprised of shoulder straps, a waist belt, and limb straps, all interconnected by strategically placed elastic bands.
There was a point where I just wanted to stop and give up. The new gait kind of gave me that hope again.
A patient introduced me to the new gait, clicked right away that it would make sense, and I've been using it with patients on a regular basis ever since.
We're a team who cares in a way that is maybe unique for this day that we live in. And there's something within me that is really fulfilled by working on this project and watching what it can do.